One of the most commonly performed facial cosmetic procedures is actually performed on and around your eyelids. It's called a blepharoplasty. And in this episode of OCuTALK, Dr. Geoffrey Kwitko will be walking us through the procedure and the post-procedural recovery process. Dr. Kwitko?
I want to talk to you.
Not now, later.
No, now.
Hello everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us. From Tampa Bay, Florida, Dr. Geoffrey Kwitko. Dr. Kwitko, thank you so much for joining us today.
Oh, thanks for having me.
Well, excellent. Again, thank you for taking the time out of your day to visit with us. Dr. Kwitko, before we get started, I was hoping that maybe you can introduce yourself to us, tell us a little bit about your background and your specialty.
Well, I'm an ophthalmologist with specialty training in oculoplastic, orbital, and neuro-ophthalmic surgery, and my practice is limited to plastic surgery around the eye and orbital surgery and neuro-ophthalmology. I've been in Tampa for 32 years and still going strong, hopefully.
Well, awesome. Well, again, thank you so much for joining us today. Thank you for that introduction. Dr. Kwitko, for our discussion today, we were hoping that maybe you could talk a little bit with us about blepharoplasty surgery. Well, could you tell us a little bit about what that is and why someone might need it?
Well, basically, it's cosmetic surgery around the eyes, getting rid of the bags above and below the eyes, sometimes combined with ptosis surgery, which are droopy eyelids, sometimes not, depending upon what the patient needs. So basically, it's cosmetic surgery designed to make people look younger, more refreshed, and sometimes helps people see better when you get rid of the droopy eyelids, and especially the droopiness of the bags around the eye.
Well, perfect. Thank you for that explanation, Dr. Kwitko. And so now that we know a little bit about blepharoplasty surgery, is there an ideal candidate that you usually have for blepharoplasty surgery?
Well, we want people who are reasonably healthy, who can undergo, usually it's done under local or twilight anesthesia. So you want people who are reasonably healthy. We don't really use general anesthesia for that. So those risks are avoided. But you want people who are reasonably healthy. Age really doesn't matter. I've done people in their 20s and all the way to their 80s. It just depends upon personal choice. So when a person comes to me for a blepharoplasty, we do a complete eye exam to make sure their eyes are healthy and there's no other issues with their eyes. We make sure that they're healthy enough to tolerate the procedure. If there's a question, we will have them see their primary care doctor to get clearance for it. So basically, we want healthy people with no significant health problems, and those are the best candidates.
Oh, well, perfect. Thank you for letting us know who the ideal candidates would be. So I know you probably touched on it a little bit, but could you explain a little bit further about, are there medical reasons for getting a blepharoplasty?
Well, the main reason for upper lid blepharoplasty is if there's so much excess skin that it's hanging over the eyes and actually blocking vision. And what people notice when they come in is they'll say that I have to tilt my head back to see, or I have to physically raise my lids with my finger, or raise my eyelids with my forehead muscle. And these are common complaints of people who are losing vision, specifically their upper visual field. What we do is we'll do visual field testing on them to see if we could document if they have loss of vision from their eyelids. And then we repeat the test, taping their lids out of the way to see if there's an improvement. We'll then submit this with photos to their insurance company. And if it's bad enough, their insurance may cover their blepharoplasty.
Oh, well, perfect. Again, thank you for that explanation, Dr. Kwitko. And can you actually walk us through the procedure? Like, how does it exactly work?
Well, basically, it starts in the pre-op holding area. Well, it initially starts in the office when we evaluate the patient. We do visual fields, we do testing, we make sure there's no other ocular conditions, and we make sure they're healthy enough to tolerate the procedure. Once we get past that and the procedure is booked, we evaluate them in the pre-op area again, just immediately before surgery. We make any markings that need to be marked before we inject anesthesia. We then take them into the operating room where we have a board-certified anesthesiologist overseeing the patient's care. And we use what we call twilight anesthesia, where the patient is relaxed and put in a short sleep while we inject the eyelids with the anesthesia, with the local anesthesia, which does two things. It stops any pain, and it also decreases the amount of bleeding that a patient will have during surgery. Once that's done, we clean off the surgical site, and we drape it to keep everything clean. All the people, myself, the scrub nurse, We're all wearing sterile clothes and sterile drapes. And then we start the procedure. Now, the procedure is simply we mark, let's say for an upper lid blepharoplasty, we mark the lid crease, the God-given lid crease that you have. We inspect it. We make sure that it's in the right spot and symmetric. We make an incision. I prefer to use a blade. Other doctors prefer to use a laser for it. The reason I don't like the laser is heat. And heat, as you know, will expand and destroy more tissue, more cells around the incision site, whereas a blade just cuts where you put it. There's no injury to any surrounding cells. We make an incision. We find the fat that has come forward, causing some bulginess. We'll remove the fat, and then we'll remove the appropriate amount of skin so we have an excellent cosmetic result. The key is you don't want to remove too much skin, so you don't want the patient unable to close their eyes afterwards. So it's a balancing act between taking out the right amount of skin to give you a good cosmetic result, but not too much skin where they can't close their eyes, which will then cause dry eye and problems down the road. One of the things patients always say to me in the consultation is, I don't want to have that scared clown or deer in a headlight look. And the reason that is a lot of surgeons will want to do a brow lift at the same time. Most patients really don't need a brow lift. It tends to pad the bill, and I won't even bring it up with a patient unless I think they need it, which most don't. Patients will then ask me about it because they've been to another doctor and who recommended it. And I will say, well, that's how you get into problems with that scared clown or deer in the headlight look. So, and that's pretty much it. Once we take out the appropriate skin and fat, we cauterize any bleeding to decrease the amount of bruising, and we close with dissolvable stitches. We will then, I'll see them post-op day one. We'll put an antibiotic steroid ointment they use for about a week, ice packs for the first 24 hours, and then we let them heal. And usually after about 2-3 weeks, healing is done.
Well, perfect. Awesome. Thank you so much for walking us through the blepharoplasty surgery, Dr. Kwitko. And we talked about the surgery. What about your pre-surgical protocol? Do you have a pre-surgical protocol for your patients?
Well, usually with any surgery, nothing to eat or drink the night before. We do the evaluation in the office for the consultation, whether they're a good candidate or not. And if necessary, we'll have them see their primary care doctor for clearance for surgery if there's any health issues. If not, the anesthesia department at the surgery center or the hospital where we operate will do a phone interview the day before to make sure there's no issues. And if there are, we will address those at that time.
Oh, perfect. Thank you, Dr. Kwitko. And I know you talked a little bit about it when you were walking through the routine of the surgery, but what does the recovery time look like after surgery?
A lot of my before and after pictures that I post on my Instagram and Facebook page are 30 days post-op. So by 30 days, they're pretty much healed up. Some people a little bit longer, some people a little bit less, but you can figure by 30 days. And so a lot of people even less than that, maybe 2-3 weeks. But 30 days are what my before and after pictures are. So if people want to see what they'll look like a month out, go look at my before and afters on my Instagram page. There's plenty of them there. And you can see that after 30 days, they're pretty much set.
Well, awesome. Thank you for that information, Dr. Kwitko. And Dr. Kwitko, I know with surgery, there's always risks involved. But are there any major risks involved with blepharoplasty surgery?
Well, there are risks. They're very rare. As I tell my patients, you have a better chance being hit by a bus going home today. But if there's a bleed post-op, you can go blind. If blood accumulates in the orbit around the eye, it increases the pressure. It can cause a compressive optic neuropathy and blind you. You can get an infection in the wound, like with any surgery. You could go blind. You could have double vision. And probably the most common complication or side effect is that the patient's unhappy with the cosmetic result. This is rare, but sometimes you have to go back and touch them up. And I always tell my patients that if we have to go touch it up, it's not a big deal. Obviously, we don't charge for that. We want the patient walking out happy with a good result. But the serious complications such as going blind or double vision, these are very rare. And if they're addressed immediately and recognized, we can deal with them. I've had other oculoplastic surgeons send me their complications. Doesn't happen a lot, but when it does happen, it needs to be dealt with right away. And I'll get a frantic call from somebody saying, I have a patient, I can't stop the bleeding, their pressure is going up, they decrease vision. And on those occasions, we have them sent over to the hospital immediately and we deal with it at that point. And fortunately, in all the cases, the patient has come out without any loss of vision. But, it's something that if it's ignored and not recognized, then it can cause blindness. And I have seen it cause blindness with other doctors when it was ignored.
Well, definitely need to go get your checkup. You heard from Dr. Kwitko there. Dr. Kwitko, are there any new technologies or new developments that are on the blepharoplasty horizon that we should be on the lookout for?
Well, there's always lasers and skin treatments, and there's like a new skin treatment every week. And the reason that is because the old ones don't work, and neither will the new ones. They have lasers out. And I started doing some laser lower lid blepharoplasty about 2 to 3 years ago. In certain patients who are good candidates, we can take the fat out from the inside of the eyelid and then shrink the skin down with a CO2 fractional laser. Now, what that does is that avoids an incision line in the skin. So even though when we do make an incision, we hide it pretty well, but this avoids that incision line. And we shrink the skin down with the laser. The new lasers aren't that, I'm trying to think of the right word. The old lasers, you'd look like a tomato for a month. And with the new fractional lasers, it's probably about 2 weeks, and it's just not as bad. It's not as much of an insult to the skin and works well. Now, you have to pick your patients carefully for this, because if you have too much skin, it doesn't matter how much laser you do, it's not going to help. You have to do an external approach and remove skin. But in selected patients who are good candidates, it's an excellent procedure. So really, it's basically laser resurfacing. That's the new technology for blepharoplasties.
Well, awesome. Thank you for that information, Dr. Kwitko. We'll definitely be on the lookout for that. And before we leave today, was there anything else that you wanted to let our audience know about?
No, just that blepharoplasties are a very common procedure. It helps a lot of people. It is not necessary. Nobody needs to have a blepharoplasty. But if you decide you want to do one, it will definitely help your appearance and possibly help you see better, specifically your superior visual field. And most of my patients, the vast majority, are very happy they did it.
Well, excellent. Thank you for that information again, Dr. Kwitko. And everyone, that's Dr. Geoffrey Kwitko from Tampa, Florida. Dr. Kwitko, thank you so much for joining us today.
My pleasure. Thanks for having me.